welcome to our Ask an Expert webcast. Today we will talk about an organization that I admire a lot, an organization that does important and very challenging work in some of the hardest to reach areas, some of the most dangerous parts of the world. Médecins Sans Frontières, the international medical humanitarian organization, better known as Doctors Without Borders. It was founded in Paris almost 50 years ago, and just after the Biafra crisis, and today it operates in more than 70 countries around the world. MSF goes where most other organizations don't dare to go. They're often the last resort, the only option for people in remote crisis and conflict areas to get access to medical care. MSF is independent. They don't take any sides in a conflict. They are there for anyone who needs medical help. And it's been an important partner for IKEA Foundations for many years. What we do together is really something special. We focus on the unseen emergencies. We focus on the emergencies that don't get any media attention and therefore have a very hard time getting any funding. We trust MSF to know where the biggest needs are, and that's how we work together. So the outset of the Ebola crisis in West Africa some years ago could be a good example of that. We'll get back to that a little later. So our mantra was always to provide quick funding support to get things started. Ebola is a good example of that. Now we have COVID, and that just get a lot of media support, so everyone knows about that one, of course, for very obvious reasons. So today my guest is Kenneth Lavelle. He's the Deputy Director of Operations for MSF in Geneva. Kenneth has 10 years of experience with MSF. He's been head of missions in some of the most challenging countries around the world, such as Congo, Liberia, Sudan. So he really has years of experience from the front line. He knows what it means to be out there and fight every day for people's right to healthcare and medical support. So welcome, Kenneth. So Kenneth, can you start by describing to our listeners how the daily operations of MSF has changed since the coronavirus hit the world? You're already operating in a very difficult circumstances and conditions around the world, but this must have made the work for your colleagues even more challenging.
Thank you, Per. Maybe I'd just like to start by thanking you and the IKEA Foundation for giving me the opportunity to participate today, and to the IKEA Foundation and all the IKEA workforce throughout the world for the support that you provide to MSF. Without your support, we would not be the organization that we are today. So just a quick thank you for that. When there's, in MSF, when there's a big emergency, it's like someone turns on a switch. Yeah, everyone mobilizes, everyone adapts their regular day-to-day activities to ensure that we're able to respond. We have additional teams and supplies that are permanently ready to be deployed. And we already have an existing workforce of nearly 50,000 people working in over 70 countries, plus years of experience in responding to these outbreaks. We've also invested over the years heavily in logistics, because it's one thing to have doctors and nurses, but if we can't get them there and if we can't supply them, then it really curtails our capacity to respond. But for sure, what we're seeing today with COVID is massive. Yeah, we're already doing incredible work in so many difficult contexts, but today, with the number of cases and with the huge restrictions that are being put in place in terms of being able to move people and supplies, the fact that even I might be in the office today in Geneva, but I'm one of the only ones. Everyone is working from home. So it's been a huge challenge over the last couple of weeks. And for sure, there is an impact on my day-to-day work and of my teams here in Geneva. But our biggest concern is the impact that this pandemic is going to have on some of the most vulnerable populations in the world.
I can imagine. This is something we haven't seen before, at least in our lifetime. So Kenneth, until COVID really took over the media completely, we could read a lot of reports about the refugee situation in Greece, because Greece is part of Europe and it's closer to us than many other situations that you are involved with. And we hear about the terrible conditions facing people stuck on the Greek islands. I know that MSF was, and really is probably the only option for children who need access to medical services on Lesbos. I was there recently and saw your operation. And that's one thing, but was MSF as an organization really prepared for a pandemic like COVID?
Oh, we are an emergency organization, Per, and we always respond whether it's cholera, measles. You mentioned Ebola earlier on, but I don't think anyone was prepared for the scale of this outbreak, of this what is now being declared a pandemic. And certainly we were not prepared for the massive restrictions that have been put in place. As I mentioned, as an organization, we rely on rapid response, having agile, flexible interventions, but with a limited ability to move people and supplies, it's a huge problem for us. But like in Greece, like in all of our projects, we have already medical teams in the field. They have got supplies, but rapidly teams are getting tired. People need to be replaced. We need to send additional supplies. And in many of the countries where we're already working, the existing health systems, they are extremely fragile. Yeah? There are not enough intensive care beds in Europe. So the situation in many countries is 10 times worse, if not 100 times worse. And specifically for the refugee populations in Greece, on the islands, I mean, you were there, Per. You have seen the conditions in which they are living. As an organization, we are just about able to provide the basic health care, to provide shelter, to provide water and sanitation. And now with COVID arriving, it's going to be a disaster for some of these populations. And already on the mainland in Greece, there is already in one of the camps, I just received information that there is someone that is tested positive for COVID. So it's happening now, and it's going to be a disaster.
So given this outlook, how do you prioritize? Because there's so much to do in so many different places and so many new challenges in places that you aren't necessarily working, but are really under a lot of threat right now, given the quick spread of COVID and the fact that you have a lot of people living in condensed conditions where this social distancing thing that we do in Europe would never work. And they don't have access to clean water. Maybe they can't wash their hands every day. And they can't wash their hands every hour as we do. So what do you think is going to happen? And how do you prioritize your resources and your people? Because in addition to the fact that you have limited number of people, you also have travel restrictions and what have you. This must be an extremely challenging operation for you right now.
Yeah. The message that we've had to send to our teams in every country where we're working is that you have to get reorganized. We will not be able to send reinforcements today or maybe even for the next couple of weeks. So we have got hugely experienced teams. We have been preparing response plans over the last 6, 7, 8 weeks. And as part of that, we are going to have to take some very, very difficult decisions. Because if in the Greek islands, for example, there is a huge outbreak of COVID, with the limited teams that we have in place, with the inability to send additional support, we're going to have to stop other activities. Now, do we stop the mental health activity? Do we stop the maternal health, the deliveries? These are the decisions that we are having, we are taking, and we will have to take in every project, in every country where we work. And in some of these locations, MSF is the only provider of healthcare. In the refugee camps in Kenya, in Bangladesh, we're going to have to decide on what priorities we will put in place to hopefully limit the spread of COVID, but also to be able to maintain the minimum of activities minimum medical services for the populations that we're already trying to assist. And I'm here in Geneva. I would love to be able to fly tonight, tomorrow, to help our teams in the field, because it's the doctors, the nurses, those that are on the front line that are going to have to take these decisions. We will support them as much as we can, but it is going to be extremely stressful for our teams and ultimately for the populations. So it's not going to be good.
I can imagine. And we think we have difficult decisions to make here in Europe, in different countries across Europe. And with the resources that we have available in this part of the world, that's nothing compared to what you have to deal with. And as you said, sometimes you're the only game in town. You're the only access people have to healthcare, to the kind of services that we take for granted in our part of the world. Could you tell us a little bit about how MSF is preparing to respond, or is already responding, in the typical countries where the ITF Foundation is active, such as in East Africa and South Asia?
For example, in Southeast Asia, our biggest concern is in Bangladesh, in the huge refugee camps there that are providing support to the Rohingya population from Myanmar. So the teams are getting prepared. So far, it hasn't hit the camps, but the teams are getting prepared. There's a lot of work that can be done to prevent the spread. So we are stepping up in terms of water and sanitation. As you say, they can't wash their hands every hour if there's not enough water, if there's no soap. There's a lot of health education that we need to provide to these populations to explain to them about the disease and what are the very, very basic measures that they can put in place in extremely precarious situations. And it's a constant dialogue, working with the communities, because it's one thing to put in place a medical structure for some kind of hospital-based care. Yeah, it's not Geneva. It's not we can't put in place these intensive care units. So we really have to focus as well on working with the communities to help them understand and try to improve some of the basic practices that will hopefully prevent the spread of the disease. We're scaling up our teams in Myanmar, in India. India is going to be a big challenge, just the population size. Now, we do have teams in Mumbai, we have teams in Delhi, we have teams up in Ranchi in the northeast, and they're all trying to get ready. In East Africa, I've already mentioned, the refugee camps in Kenya and in Tanzania, the camps in Ethiopia. But what happens if COVID comes into an urban center like Nairobi? In these slum areas, that is going to be another incredible challenge that we're going to have to try to work with the authorities to face. And it's, in all parts of the world, Per, you were in, or I think your team were in Swaziland recently as well. There, how are we going to step up to assist the Ministry of Health there? These are populations with a high prevalence of HIV and tuberculosis. They are vulnerable populations. So what is going to happen to these populations when COVID starts to appear? So our teams are stepping up and trying to prepare as much as possible in every corner of the world where we're present.
Yes, you mentioned the slum dwellings. So let's take Kibera, for example, in Nairobi, with thousands of people. How do you specifically prepare for a possible outbreak there? What is MSF doing today? Because prevention is in general more effective than cure. So if you can prevent something from breaking out, is it any different than what we're doing here in isolation?
It's going to be completely different. The majority of these people in these slum areas in Kibera, for example, in Nairobi, they live day to day. In Europe, they have confinement. Everybody gets their monthly salary. It goes into the bank. you can stay at home, governments are supporting individuals and businesses. That's not going to happen in the majority of places where we live. They have to work every day in order to put food on the table. So how is a government going to tell people to stay at home? Forget about washing hands and the fact that people are living 10 people to a shelter made of plastic sheeting and old bits of wood. Forget about social distancing. But people need to eat. So the restrictions that we put in place in Europe are not going to work. And I'm really concerned that the governments themselves, they are not prepared on how this is going to be managed. And for MSF, we can't do this on our own for sure. We are not the Ministry of Health. That's why we really have to partner with the ministries of health in these countries. They're already asking for support, technical support. They want guidance. So we'll work very, very closely with them to provide whatever support we can. And when something happens in one of these areas, our teams will try to respond, but it's not going to be the same as in Europe. In Burkina Faso, for example, there are 10 ICU beds for a population of 20 million people. So the pain is going to be enormous in these communities. And we don't have all the answers yet, Per. We're learning as much as anyone else is due to the scale of this pandemic.
That's an excellent point, because that's the situation everywhere, of course. But can you tell us a little bit about how you systematize your learning? Because humans get learning in from all over the world all the time, and you're able to build a bank of experience and knowledge that's quite unique.
It's a challenge. One of the things with this pandemic is that it doesn't respect borders. It doesn't matter how much money you have in your bank. It doesn't matter what your position is socially or whatever. It's affecting everyone in the world. And it is nice to see that scientists, medical specialists all over the world are mobilizing. They are looking for new treatments. They are looking for vaccines, the different protective equipment that medical people need to be able to handle patients. So there's huge amount of innovation that is coming through. So we've got a team of specialists throughout the world that are in contact with these universities, with these ministries, with governments, to kind of go through everything that's been produced, filter it, and then try to see what are the innovations or the new ways of working that will be adapted or that can be adapted to some of the locations where MSF is working. The other side is in terms of the epidemiology, so studying the outbreak. And we are trying with our specialists to, for example, with the Johns Hopkins University in the US, to do modeling. So if there is a case which comes in a refugee camp, how many days do we expect before it absolutely explodes? And therefore, hopefully, we can have a better anticipation of what MSF needs to do in the first few days, the first few weeks. So it's great, and it's great to see the world mobilizing. It would be great if the world did this for every type of disease outbreak that there is, measles, Ebola, cholera, not just when it hits Western societies. But we've got our teams working round the clock with these specialists to see how it can help us and therefore the populations in the many areas that you've described as well, Per. We're all learning every day.
So you're saying there's already a good ecosystem in place with people collaborating, sharing experiences, day-to-day learnings, and in a way that it benefits everyone's planning for what to do, not next year, not next month, but not next week, but actually next day.
That's it. And we also have to acknowledge that because of the scale of this outbreak, that we're going to have to take some risks. We are going to have to try new approaches. We are going to have to test new medicines, new medical equipment, vaccines, but vaccines is going to be some time away. So we do have to be ready to partner with the medical world, medical ecosystem, to see how MSF can use the strength of our organization to help drive innovation that will benefit everyone.
You mentioned food and access to food, and that's of course not necessarily MSF's role, but at the same time, food is directly related to health and immune system. And with lack of food, and especially lack of nutritious food, we'll have to assume that for many of the people living in these countries, their immune system is not at the level of the immune system that you see in the Western world. Would that be fair?
It's absolutely fair. I mean, you whether it was during your visits to Lebanon or recently in Greece, you've seen the conditions that the people are living in. You see that they are fully dependent on the assistance that is provided by organizations like MSF. So if food does become more scarce, if rations in these refugee camps are cut, then their capacity to as individuals to fight this virus is absolutely diminished. So it's a it's becoming, in some areas, it's like it's a vicious circle that is developing for some of these populations.
Yeah, you mentioned Lebanon. When I visited your operations in Lebanon last year, I was really shocked to see that more than 1 million Syrian refugees are still living in appalling conditions in the Bekaa Valley. Some of them under plastic tarpaulins after almost 10 years. And they still rely on MSF as the only option for any kind of health services, whether it's emergency medical support or just your normal lifestyle diseases such as heart conditions, diabetes, maternal support, as you said, psychosocial support, which of course is badly needed for people who have lived through very tough traumas. Yeah. So I think Lebanon has become an unseen emergency because you never read about this, you never hear about this, but it's more than 1 million people. So it's bad enough already, but how has COVID changed the situation for them, you think, and for you operating in that area?
Well, thankfully, so far, there are no confirmed cases in the displaced camps that you've described in the North Bekaa. But our teams are getting ready for it. There are already a lot of cases in Lebanon itself. Our teams have already been supporting the Ministry of Health in the main hospital in Beirut. We are setting up, or we are repurposing. We have a pediatrics hospital in the south of the Bekaa Valley. We are repurposing that to be an intensive care facility for COVID cases. And then our mobile teams that you would have seen that are going to the places like Ermel and Arsal and all of these camps that are spread out all over the Bekaa Valley. So the teams are scaling up. We are going to try to increase the number of teams to be ready to be able to do the community education and then to be able to have people that can identify the cases as early as possible. Because if we can get early identification of these cases, isolate them, and then hopefully reduce the level of transmission at the community level. But you've seen the area geographically, it's the entire Bekaa Valley. There are hundreds and hundreds of thousands of refugees. So we will do what we can, working with the Ministry of Health and any other organization that might be present. And there I think it's just to limit the spread. But how we're going to do that, we're going to have to learn that on a day-by-day basis. But it's, you mentioned these kind of forgotten crises. We've teams inside Syria as well. So how are they going to be able to respond in the area around Idlib, where there are still bombs falling, where they're still fighting on a daily basis, We have the same questions in Yemen, where MSF has got a huge volume of activities. Now, it seems that they are maybe talking about a ceasefire during the COVID period, which would be fantastic. But if not, these populations are going to suffer. Well, they've already suffered because of war, displacement, disease, and now COVID is going to arrive on top. At some point, you begin to despair. Huh? And my feelings are really with the medical teams that we have in each of these projects and how they're going to have to make these difficult choices in the days and the weeks ahead.
You mentioned Idlib, and when I had a chance to meet with Dr. Bamani Balour recently in Geneva, she came here in connection with the screening of the film The Cave, which actually describes her underground hospital that she ran for several years in Idlib. She kept reminding people that this is not over. This is the situation for everyone in Idlib today. This is not some story that happened in the past, and we tend to forget that. And especially now that we're so occupied with what's happening on our own back door. So what we can do, what can we do? I guess you are probably you're scaling up as much as you can with staff in the areas where you operate to meet this new challenge. But what you need mostly right now to sort of continue to accelerate the great work that you're doing in communities that are affected. What do you need as an organization?
Well, we're trying to scale up activities everywhere that it's possible, but as I already mentioned, we need to secure more supplies of key materials, such as the protective clothing needed by our patients, our supply team by our patients and by our doctors and nurses. We have a supply team that are working 24 hours a day to try to find new stocks. But the problem is that governments are potentially going to start requisitioning these stocks. You know, we've seen it in Europe, and it's going to be even more difficult to secure these supplies and to deliver them to our projects in some of these very, very hard to reach places where MSF is already present. And we want to send more people to support, you know, our specialists, our doctors, our epidemiologists, our logisticians. So we're working with different governments, trying to organize charter flights that we can use to send people to West Africa, to East Africa, and to other locations. So but the world is kind of closed down, you know, and every government is fighting for resources. So we're having to negotiate at all levels to try to secure material and to secure access for our people. And I don't think we're going to have too much success over the next couple of weeks. But as I said at the beginning, we do have our teams already in the field, and they are going to struggle. It's going to be difficult, but they will do the best that they can with the resources that they have until we are able to provide some solutions in the coming days and the coming weeks.
So I hear you saying that the access to supplies is currently a bigger challenge than access to funds. Is that correct?
Yes, I mean, for sure, MSF, as you mentioned, we're a very independent organization. We don't, we rely on the generosity of individual donors and foundations throughout the world. And, you know, we will appeal for more funding, and the IKEA Foundation have already been extremely generous once again. And it just reinforces the kind of special partnership that we've built up over the last 7 years. So we will be asking for further donations. We will be launching an appeal probably in the next couple of days. And if people can provide funds, that it's fantastic. Yeah. I think what we also need is we need more understanding. We need people to understand that yes, this is a crisis in Europe, in our home societies in Switzerland, in Germany, France, Italy, Spain, the US. But when this really takes off in the countries where MSF is working, it's going to be catastrophic, 10 times, 100 times worse. So we need that understanding. We need the solidarity of people throughout the world. This is not a disease that respects borders. It doesn't respect, as I said, how much you have in your bank account or what government you have in place. It's affecting everyone, and these things always affect the most vulnerable populations the most. So yes, we need financial support, but everyone in the world needs to come together to have a mutual understanding of what this means for the most vulnerable populations. And for me, that's something's more important than the bank transfers or whatever. The world is changing, and this pandemic, I believe, is going to change things in the long term.
Yeah, you mentioned the funding, and one of the things that really makes MSF very unique is that individual donors and institutions like the IKEA Foundation is making up about 95% of your donations. And you don't get funding from the traditional bilateral donors to countries because of your need to be independent, need to be able to go into any war situations in the world and be seen as an independent player. And so in that sense, what are the best ways that an individual or business can support an organization like yours that really works on the front line every day? It's the best thing for people to actually look for ways to support you financially. Is that the most important thing for you right now?
For me personally, it's solidarity and understanding, and I think that level of compassion, which we are seeing illustrated in so many ways throughout the world, for me is touching, and it's so important. But if I put my deputy director hat on, for sure we do need financial contributions without question. We do have many opportunities for people to work with MSF, but at the moment we can't send the people that we already have. But if people want to learn more about MSF and to understand what we're doing, to share that with their neighbours, with their work colleagues, that for me is hugely important. And if anyone wants to work with MSF in the future, then there are countless opportunities there. But today, solidarity and financial contributions are going to be the key things that are going to help MSF and these populations to defeat, to win this fight against COVID. Yeah, that's what we're going to need, because it's going to be a huge challenge, one that MSF has never faced on this scale in its history.
So compassion and solidarity is of course something that would always be important for your support, and for people to sort of lift their view and understand that this is not only happening on your back door in Europe, but this is going to happen at a much larger scale in other parts of the world. And that was partly why we wanted to do this webcast, because we tend to look at our own backyard, and we tend to forget about what's going on in the rest of the world. And that's where you are, because most of your operations are in disaster areas and conflict areas. And if we could do a little thing to help you increase this compassion and this understanding for what's going on and what will come, that will be a big step in the right direction. I was always impressed by your focus on cost effectiveness, and I keep telling people about the fact that MSF to me seems like a very cost effective organization. Out of your annual budget of 1.6 billion euros, which is a huge budget, only 5% of that goes towards administration. How do you make that happen?
I would need to have a sit down with the general directors and the finance directors. But what we have in MSF, it's a sense of belonging, of family, in a sense, that above and beyond what we're doing as an individual, we're contributing to a greater mission. You know, everyone in the organization that I know started working in the field as a logistician, a doctor, a nurse, and you really feel when you're in these contexts, when you're providing direct support to people, you feel a real sense of belonging to the organization. And how that then translates is that everything that we do, when you're sitting in my position or my colleagues down the corridor, it's about delivering the maximum amount of assistance to the people that we knew when we were in the field and that our colleagues today are working on a daily basis with. And that, I'm not going to say we're a cult, but there is that kind of a sense of belonging to the social mission, to our charter. But we have to do better, you know. If you say 5%, then I'll ask them, why is it not 4%? Because we've always got to challenge ourselves internally, you know. It's the same as any organization. I'm sure it's the same with IKEA. How can we do things better for our employees, for the organization, for your customers, for our patients, you know? And for me, it's part of MSF, you know. How can we do better? How can we deliver more with less? And it's not just me. I think it's everyone in the organization, and we're really lucky to have that kind of feeling for what we are doing. But we should do better. Every day we should be thinking in that way. The needs, you've seen them there, the needs are just enormous. So if we can save a little bit here, a little bit there, that means more is going to go where it's needed.
No, you sound like you work for IKEA. Constant improvement is one of our values. We strive to be better all the time. But I can tell you, I visit a lot of organizations in Geneva, and when I walk through your door to your office in the Rue de Lausanne in Geneva, it's a different atmosphere, and you can feel this feeling of family, of solidarity, and this simple way of wanting to get things done. And it's amazing. It's really, you are an incredible organization, very different to very many of the organizations that we are in touch with throughout the year. Can I ask a different question?
Yeah.
What do you think would be the first thing that MSF will do as an organization when everything gets back to normal, whatever normal is going to look like?
I don't know. A lot of people say that the normal is the problem. You know, that we can't go back to the way that we were, how the world was running itself. But for me, being part of a medical organization, you know, when I'm in my apartment in Geneva and at 9 o'clock every night, people are out in their balconies clapping, cheering for the medical staff, that for me is already a sign that things are moving in a different direction. Public health matters. You know, investing properly in medical care, yeah, that matters. It should not be a choice for governments. It should be a priority. Governments throughout the world have not been ready for this. We are seeing cuts in health services. I'm from the UK and Ireland, and I've seen it firsthand. This cannot continue. Today, the heroes are the doctors and nurses. They should always have been the heroes, and they should continue to be the heroes tomorrow. Good health is, for me, it's a civil right. It's a human right. And I think, hopefully, that governments in the West and throughout the world will hopefully wake up and understand that. Health matters. Public health matters. So for me, I could talk about if, you know, what should change? Climate change. If we can mobilize the world to respond to COVID, how can we not mobilize the world to address the next or the biggest issue that faces humanity, the change in the climate? So, you know, I'm really hopeful and I may be a little bit utopic, I don't know, that this pandemic, as distressing as it is for individuals and families and for communities, that health will become, if not the number one of the top priorities for governments going forward. And whether, as I said, for MSF, we will, I'm not sure what normal is. We will continue to address the medical needs of populations. We will continue to lobby for better access to healthcare, more investment, cheaper drugs, better diagnostic tests, everything that we've been doing for the last nearly 50 years.
Well, maybe this, I mean, we have to continue to be hopeful, Kenneth, and maybe the silver lining is that this will actually have the effect that we are, as a world community, going to start to focus on the more important things as we go forward. I really hope so. I was in New York during 9/11, and the days after 9/11 happened, there was a sense of solidarity. People interacted in a very different way, and it was an opportunity to start on a new journey. And I don't think we really were able to take advantage of that opportunity and really make a big change in the world over time. Let's hope that now that we have a crisis that really impacts every single individual in the world, let's hope that that will give us the opportunity to learn from this and create a different world order where people are at least focusing more on solidarity and helping the vulnerable, because helping the vulnerable is what MSF has done for the last 50 years.
Yeah, I hope you're right, Per.
Do you have any final message for us? Any advice to our viewers today?
Well, I just again want to thank you and the foundation, everyone in IKEA for the support. In terms of final messages, yeah, I mean, look after each other. And it's fantastic to support MSF, and we'll continue to do our best for these populations. But don't forget your neighbour. Don't forget your loved ones, your family. This is a horrific situation that everyone is, and it's, as you said, everyone is impacted. And as much as I would like to look forward and to hope that things will change, I think that you talk about 9/11 and the sense of solidarity. I think through the last few weeks, I think everyone is trying to be nicer to each other. It sounds silly, Per, but if that can continue, the spirit between people that we've seen over this last period, if that alone can continue, then we will hopefully, as a human race, we will have learned something about this outbreak. But look after yourselves, stay safe, wash your hands if you've got soap and water, and look after your loved ones. This is going to continue for some time, and hopefully we will all be better people, nicer people as a result of this horrific situation that many of us and our loved ones are experiencing at this time. So, and again, thank you, Per, and your team there.
Well, on that positive message, I hope everyone listening and viewing will join me in thanking Kenneth and his tens of thousands of people, many of those volunteers who work so hard on a daily basis around the world under the most challenging and even dangerous circumstances to help desperate people in need. MSF is really an amazing organization, Kenneth, and we're really proud to be partnering with you. Thank you very much.
Thank you, Per.